everyone, Erin from Employer Direct Care again with the next video for you. And today we have a very special guest and good friend of mine, Dr. Shelley Brown. Dr. Shelley is a graduate of the Ohio State University Doctor of Nursing Practice. She works as a psychiatric mental health nurse practitioner at Hopewell Health Centers in Athens, Ohio, and is board certified in adult psychiatric mental health and is a certified addictions advanced practice registered nurse. I asked Shelley to kind of meet with us this month because it is National Alcohol Addiction Awareness Month. And this is a topic that is really important and oftentimes is not really discussed. There's usually a big stigma that goes around abuse of drugs and alcohol and addiction in any forms. And, I really want people to know that this is something that, we need to address, we need to talk about. In my practice throughout the years, I've noticed that a lot of people really underestimate how much they do drink and what problems that there really are. And they might not be recognizing the impact to themselves and to their families. So what are some things or clues that we may notice in a person, whether not just a healthcare provider, but a family, a friend, someone who may have a problem with alcohol?
Sure, Erin. So, one of the things I think is important to look for is that if you start to notice one of your family members starts to have an increase in their drinking, so maybe they used to only socially drink on the weekends, all of a sudden now they're drinking every other day or daily, definitely an increase in the frequency is something that we would be concerned about. If they start to have problems associated with their drinking, so if they start to have kind of social problems, not getting along with friends or family members, relationship problems, and certainly problems with their work, that would be a sign too that maybe someone is starting to have some issues with drinking.
Okay. So how much is too much? You read on the news and, if you weigh so much, if you're male or female, and, you hear people sometimes talking, well, I'm fine because I'm a big guy. I can tolerate more than what somebody else can. So what is kind of is there a standard or I don't want to say a goal, but, of what is considered too much?
Sure. Yeah. So we would consider a standard drink for men to be 2 drinks and a standard drink for women to be 1 drink per day. And so we would consider excessive drinking for men to be 15 drinks per week and then 8 drinks for women per week. So anytime that you're drinking more than 1 to 2 drinks, we would consider that to be starting to move towards excessive drinking.
Now, when you say drinks, are you talking about, 2 bottles of wine as a drink, or
right?
I've had some individuals who they think, oh, I only drink two drinks, but it's a fifth of a bottle or something.
Yeah, absolutely. It would be like like 8 ounces of wine or a can of beer, a small bottle of beer, a typical bottle. That would be what we consider 1 drink for sure. Certainly there are people who we always have to kind of ask about, how much you're drinking and what's that size for you, because I've seen people tell me 1 drink is like a 1/4 of liquor. So absolutely.
So what are some complications? Why is this such a big deal? I know, I look a lot of times at this can affect your liver, this can affect all sorts of organ systems, but other than that, I do have a lot of people that say, oh, no, my drinking's fine, my liver's fine. How do we really get that point home that there may be some things that they're not recognizing as issues?
Sure. Well, from a physical health standpoint, certainly other than kind of cirrhosis and liver damage, we know that drinking has been linked to other issues with the stomach, as well as can increase risk for pancreatitis and certain cancers, esophageal, throat cancer, stomach cancer, liver cancer. It definitely can cause problems with the heart, high blood pressure specifically, and really puts us more at risk for things like accidental falls or injuries. Certainly drug driving is a major issue for people when they're kind of excessively drinking. Maybe they're not making the best choices, right? Domestic violence. So we know people are more likely to harm other people if they're under the influence of alcohol. And it also kind of worsens mental health symptoms. So people can be more depressed, more anxious, and that kind of disinhibited feeling that people get from alcohol combined with a worsening of mental health symptoms can lead a lot of people to attempt or complete suicide.
That's certainly something that I don't think sometimes people think about just all the facets of what, uncontrolled drinking can do. Are there certain age groups that are affected more than others?
Yeah, so mainly we see a larger portion of individuals between the age of 18 and 25 who are excessively drinking. But certainly we see people in all age groups, and in that 18 to 25 group, it's pretty equal between men and women. So, but definitely all throughout adulthood, we see people that have problems with this.
So I think one of the big topics and things that as a healthcare provider, even I kind of struggle with in today's world. We watch the news conferences at 2 o'clock, and we're starting to see more and more of the mental health crisis hotlines come up. And, they were saying how alcohol sales were up over 20% in the last few weeks. And to me, that's very concerning. I mean,
Yeah.
I understand that, people aren't working and maybe they're sitting at home more, but what are some of the ramifications of this, or what are you seeing, and how do we really start to deal with this as, as companies, as healthcare providers, as a community?
Yeah, absolutely. So I think really a lot of people are using alcohol as a means to kind of self-medicate mental health symptoms. And I do think, especially in my own practice, we've seen a drastic increase in mental health symptoms in people in the state of Ohio, a lot of depression, a lot of anxiety, many, many fears about COVID-19. The isolation piece that people have had to kind of isolate from their family and friends and not be at work, as well as all the financial struggles, really have kind of increased those symptoms of depression and anxiety for a lot of people. So I think people are trying to turn to things to try to help minimize some of those symptoms. Unfortunately, we know that the use of alcohol is not going to help eliminate mental health symptoms, and certainly it can make it worse. But the mental health field, we are still, most agencies are open. We are doing, video and phone calls. And so people can still have a lot of access to treatment and help without leaving their house. And so definitely there are a lot of other ways to help kind of combat some of those symptoms without using drugs or alcohol.
So that's very important. So if someone, especially during these times of isolation, I know the numbers in my office of patients coming in or phoning in have decreased for fear of contracting COVID-19 and for other reasons. But if someone, or now they're sitting at home with their family and maybe a family member is like, oh, I didn't realize this was a problem, or maybe it's not, and maybe it is just a coping situational type deal that they need help with, what are some routes they can take? How do they get help?
Sure. Yeah. So one of the easiest ways to kind of get help is to Google the Ohio Department of Mental Health. They can list all of the areas locally to you based on zip code and county, to where you can go to get mental health treatment. Many areas, most areas of our state have at least one mental health agency in the community, even if it's rural. If you're living in a major city, certainly there's many, many, many offices available. But going to the Ohio Department of Mental Health is a good way to find, offices where people could seek mental health treatment.
Wonderful. And I'll make sure that we post that at the end of this video in case somebody needs that resource. One thing kind of near and dear to my heart is, the type of clinic that we have is, these are a lot of factory type jobs, construction, and, what are some things that, maybe I can step up and really help some of my patients if they come to me with some of these issues. Certainly I know some of the local resources, but sometimes I think people are afraid to maybe talk to me because I do work with their companies. And I certainly want to make sure that they know that everything that, we talk about is strictly confidential and does not go back to their employer. But, what are some things that maybe we could offer in the clinic, or that that might be helpful to these individuals to know that, hey, we are here for you, their companies are here for them?
Yeah, well, I think certainly if patients didn't feel comfortable maybe talking with you guys because you are associated with their workplace, referral to outside agencies. There are just counselors and therapists I know who are, in a lot of these mental health agencies, but are also in private practice offices that are doing a lot of telecommunication appointments right now. So certainly that could be a resource for them. And then most counties have a crisis line. And so the crisis call line number varies by the county that you live in. But certainly maybe we could post that at the end. That is a number that people can call. It is confidential, and they can just talk to someone who has training in mental health, and they can get them the best resources available to them, especially if they need further care, or they can just have a discussion with them and talk about how they're feeling.
Wonderful. I also do understand, a lot of the companies and through either their HR department or their insurance plans have employee assistance programs or EAPs. So that is something that's certainly available that, does not even really have to come through me or the clinic or provider. They can just ask for that. It's also confidential. Many companies have several of those visits are for free before they even would go through your insurance. So have you had pretty good success with some of that utilization as well?
Yeah, absolutely. Yeah, I think the employee assistance programs are always a great resource for individuals, and so yeah, absolutely.
Wonderful. So we'll kind of wrap things up here. I will post the Substance Abuse and Mental Health Administration hotline, which is also available 365 days a year, 24/7, which is 1-800-662-HELP or 4357. So if you just have questions about, hey, does my mom, dad, brother, sister, girlfriend, boyfriend maybe have a problem, and you don't want to approach it unless you feel like there truly is, they can certainly guide you, and you can kind of give them a little bit of a scenario and maybe some ways to help. Because certainly we want to be considerate. This is a disease process, and we want to treat it like any other disease process. So I just want to thank Dr. Brown for taking some time to speak with us today, and please look for some of the resources at the end of this video. Employer Direct Care has been and will still be open 5 days a week, our normal hours. So if you or a family member have a question, please feel free to give us a call, and we'll kind of help walk you through what your resources are. Thank you, Shelly.
Yep, thanks, Erin.